We're going to now do a 360 of the room. Okay. I'm going to show off my nursing attire, nursing badges. You can see me. Hi, my name is Marcus Whitfield. I'm a nursing student, and this is my head-to-toe assessment. Here today I have my patient. Would you like to disclose your name and date of birth?
Clark Jefferson, 3/31/2004.
Okay, so then we're also going to double check with the wristband. So we say Clark Jefferson, 32104, 32104. That's great. And then after that, we're going to wash hands, ensure privacy, clean stethoscope, and then we're going to assess patient's appearance, build, speech, and mood. So we'll say appear stable, normal speech, normal build, calm mood, and then we're also going to see if they're oriented to person, place, time, and situation. So do you know who you are?
Yes, I'm Clark Jefferson. I am currently at the School of Nursing. I am here for a head-to-toe assessment, and it is about 1 p.m.
Yes, so that's assessing person, place, time, and situation. And then after that, we're going to ask our 3 cardiac questions. So do you experience type of like chest pain, chest tightness?
No.
Any shortness of breath?
No.
And then how you supposed to sleep with at night?
1.
1, so that's normal amount. And then going from there, you want to inspect the 5 cardiac areas for any lifts or heaves. Starting in the second intercostal space on the right, you have the aortic. Across from that, you have the pulmonic. In the third intercostal space, you have Erb's point. Skip the 4th. 5th, you have tricuspid. And along the 5th, still above the nipple, you have mitral. So we'll say no lifts or heaves appears to be found. And then going from there, you want to then palpate the same 5 areas. Check for any pulsations or thrills. So you would palpate that. So aortic, pulmonic, Erb's point, tricuspid, and mitral. Will say no pulsations or thrills appear to be found. And then as well, you want to palpate the apical pulse above the heart, see if it is palpable. So we'll palpate that. We'll say apical pulse is found to be palpable. And then going from there, you want to then auscultate using the diaphragm side to see if all sounds appear to be normal. So you will go aortic, pulmonic, Erb's point, tricuspid, and mitral. We'll say all sounds appear to be normal and healthy. And then you will also as well time the apical pulse for 60 seconds. So we'll do that for 60 seconds. I don't know if actually, we'll say 7, 58, 59, 60. Should be between 60 to 100 beats per minute, which is normal.
Might just do about like 78, 80.
Yeah, we'll say it was about 72, which is normal. And then going from the diaphragm side to the bell side, you want to again go over the 5 cardiac areas, listening in for any murmurs. So you would do aortic, pulmonic, Erb's point, tricuspid, and mitral. We'll say no murmurs appear to be found. Then that's it for cardiac. And then moving on to peripheral vascular, you would then ask, are you experiencing type of like leg pain, leg cramps,
No.
Swelling in your arms or legs,
No.
sores in your arms or legs?
No.
Okay, then going from there, you want to have them turn the neck 30 degrees, and then you want to inspect for the JVD, see if there's any type of pulsations, throbbing, distension, anything out of the ordinary. We'll say no, anything like that is found. And then you want to then palpate the carotid pulse to see if it's palpable. So you would feel the carotid pulse on both sides. So we'll say carotid pulse appears to be palpable. And then you want to as well have them hold their breath, and you would continue on the bell side, and then you would check to see if there's any bruise found within the carotid pulse. So you would check both sides bilaterally, say no bruise appear to be found. So then going from there, you would go through the peripheral pulses, and then you would feel bilaterally to see if there's either strength, if they're regular, and to see if they're strong, irregular, if they're symmetric. So then you will start with the radial pulse over here by the thumb. Feel for that one. Okay, the same thing bilaterally with the radial pulse. And then moving on to the ulnar pulse, which is by the pinky, you will feel for that one as well too. Feeling it bilaterally. Okay, and then moving from there, you will go to the brachial pulse, which is above the elbow. So you would feel for that one, and then the same thing on the other side. And then from there, you have the femoral pulse, which is the connection between the hip and the thigh. So you would feel for that pulse on both sides. And then you have the popliteal pulse, which is behind the knee. So you would have them raise their leg and feel the pulse within that. Same thing bilaterally. Okay, then you will move to the dorsal pulse, which is above the foot. So you would feel for that pulse as well, bilaterally. Okay, then finally you have the posterior tibialis pulse, which is within the inside of the foot by the ankle. So you would feel for that one as well. Okay, same thing for this one. Okay, so we'll say all pulses appear to be strong, regular, and symmetric. And then from there, you will go back to the radial pulse, which is by the thumb. You will count for 30 seconds. So 27, 28, 29, 30. We'll say it gotta be between 30 to 50, so we'll say 44, which is normal. And then from there, you want to check the capillary refill of all the fingers and toes. So we'll hold them down for a few seconds, then let go, and it should refill with blood within less than 2 seconds. So you would hold those. 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2 as well for the toes. So we'll 1, 2, 1, 2, 1, 2, 1, 2, 1, 2. And for these as well. 1, 2, 1, 2, 1, 2, 1, 2, 1, 2. So they all appear to be normal, and then you want to use the dorsal side of your hands and feel the lower extremities for any type of high temperatures or irregular temps. So you would use the side of your hands, you would feel on the legs bilaterally. So we'll say no high temps appear to be found, and then you want to as well check for any pitting edema in the shins, top of foot, and ankles. Checking, so you would hold for 5 seconds and then see if there's any cavage created from your fingers. So you would check that bilaterally as well too. So 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. And then the top of foot, you do 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. And then as well the inside of the foot. 1, 2, 3, 4, 5. Okay, all appears to be normal as if for peripheral vascular. And then moving on to thoracic and lungs, we'll ask the 3 questions: are you experiencing type of chest pain or chest tightness?
No.
What's the questions? Hold on. Chest pain and chest tightness, shortness of breath, any pain while breathing?
No, and no.
And then as well, you would ask, do you smoke any cigarettes, vapes, or pipes?
No.
You say no, that's great. Make sure they're at a 90-degree angle if they weren't already. And then as well, you would inspect the anterior part of the chest. You will see if there's any types of asymmetricism, so we'll say symmetric overall. And that's why you're inspecting the intercostal space to see if there's any type of bulging or retractions. We'll say no bulging or retractions found. And then you want to as well palpate in 8 different spots. You would palpate for any type of tenderness, crepitus, tactile firmitis, or vibration symmetry. So we'll check that in 8 areas. 7, 8. We'll say none appears to be found. Vibrations appear to be symmetric. And then going from there, you want to auscultate. But not auscultate. You want to then percuss for any resonance. So you would use your knuckle. Then you would again go in the same areas, check for any resonance. So we'll say there is no resonance appears to be found. And then you want to auscultate lung sound. So you will go in the same 8 areas, and then I'm gonna have you breathe in and out slowly upon command. So then you would breathe in, breathe out, 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 breathe in. Okay. We'll say lungs appear to be clear, unlabored, and regular, and then you would have them then switch to the posterior side of the chest, so you would turn around. And then checking the posterior chest, you would again inspect symmetry, so we'll say posterior chest appears to be symmetric. You want to inspect the intercostal space to see if there's any bulging or retractions. We'll say no bulging or retractions found. And then you want to also inspect skin color. We'll say skin color matches with genetic background, no lesions appear to be found. And then you want to inspect the 2-to-1 ratio, so see if it's 2 on the back compared to 1 on the side. So we'll say patient holds true to the ratio. And then from there, you want to again palpate, looking for any tenderness, crepitus, tactile firmitis, or for vibration symmetry. So we'll palpate in the same 8 areas. We'll say none appears to be found, vibrations appear to be symmetric. And then you want to, or before you percuss, you want to check lung expansion. So you would have your hands placed on the lungs, and then you would have them breathe in and out to see if it's symmetric overall. So you place on the lungs, breathe in, breathe out. So hands did open and close symmetrically, so lungs appear to take in oxygen and break out oxygen asymmetric. So then from there you want to percuss with your knuckle using the knuckle technique, again for any resonance, so you would do it in the same 8 areas. Okay, and then going from there you want to again auscultate lung sound, so you would have them breathe in and out again through their mouth upon command. So you would breathe in, breathe out, 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 and then breathe in. Okay. Lungs appear to be clear, regular, and unlabored. And then as well, you're going to check the respiratory rate for 30 seconds. So we're going to have you breathe as normal, and we're going to count for 30 seconds. So 27, 28, 29, 30. Should get between 8 to 10 breaths in that time frame, which is equivalent to 16 to 20 breaths per minute. And then going from there, you would then move to abdomen. So abdomen, you ask your 3 questions. You would ask, when was your last bowel movement?
Yesterday.
We'll then ask, are you experiencing any type of like change in appetite?
No.
And then also like difficulty swallowing, any dysphagia?
No.
Say no. Then we'll have them lay at a 0-degree angle. Hopefully the camera still shows it. Okay, bet. So at a 0-degree angle, you want to inspect the abdomen overall. So we say abdomen appears to be symmetric. Then you want to inspect skin color. So we'll say skin color matches with genetic background. No lesions appear to be found. And then as well, I just remember that the posterior looks okay. But posterior, we'll get back to that later. And then going from there, you want to, after you inspect, you want to inspect contours. So we'll say abdomen appears to be flat and slightly rounded, which is normal. And then from there, you want to auscultate vowel sounds. So you would go in all 4 quadrants. You would start with vowel sounds appear to be normal, and then you want to move to the bell side, and then you want to go over the aortic pulse, listening in for any bruits. So listening in. No bruits appear to be found. And then from there, you want to percuss using the same knuckle technique over 8 quadrants this time, checking for any tympany or dullness. So then we'll check that in all 8 quadrants. And then we'll say that there was no tympany or dullness found. Also, too, though, you want to check the umbilicus. So we'll say umbilicus aligns with midline. We'll say no umbilicus hernia found, and you want to say what the umbilicus looks like. So we'll say umbilicus is inverted, and then finally you want to palpate. So you want to check their reaction while you palpate, and you want to use 2 hands and go 45 centimeters deep. Again, in 8 quadrants, feeling for any masses or any organomegaly of like oversized organs. So you would use 2 hands, going in the 8 quadrants. We'll say no masses or any organomegaly is found, and we're good.